Hello, my name is Dr. Samia Malik. I'm a board certified neurologist and welcome to my practice. So Botox can be used in different neurological conditions. In our office, we administer Botox for patients who suffer from chronic migraines. And the good thing about is that the patient satisfaction and improvement in their migraine is tremendous. We do not wait for the Botox to be offered in the last. When we feel that a patient is candidate for that, they qualify for it, we are able to bring them in and do it in our office. It's given every 3 months. We explain everything to the patient, how it's going to be, what are going to be the signs and symptoms after the first treatment. So providing them not just the support that they're looking for, but also making them feel that they are heard and they are empowered rather than they feel overwhelmed. So Botox is one thing that we administer. We feel it is helping. Along with that, the other misconceptions that they need to stop their other medicines that they've been on for years, they can still be on it. And also there are some modifications to their plan, like offering them a nerve block when we feel like their Botox is like lingering off and it's not time for them for their next treatment. So there's so many venues that we can work on if we are able to make the patient understand and explain what our long-term goals are. So epilepsy is a serious condition that we cannot, take it easy. First of all, we need to make sure that this is what we say is epilepsy. I was trained in USF and I was lucky enough to be trained under Dr. Benbediz, and he would, teach about something that not everything that shakes is a seizure. So first of all, identifying what we are looking at. Is it actually epileptic seizures or the other one, because the treatment can be entirely different. So obviously the first thing is to identify and small signs and symptoms, and educating the family about little things like if they are able to record the episode, and clinically the symptoms before and after are really important. A lot of time patients can have subclinical seizures or in their sleep, so they get easily misdiagnosed. So identifying if it is epilepsy. Again, we offer in our office EEGs, which are done as a part of a diagnosis, or even have ability to do the long-term EEGs to make sure that what they are having is epilepsy, and then treating it timely manner. We are very lucky. We have so many options to pick from when it comes from medications, epileptic medications, and it's very concerning. Every time anyone has a seizure, it damages the brain. So our utmost, priority is to make them seizure free, and making them understand how important it is medication compliance and close follow-ups, their blood work to make sure their levels are fine, they're not experiencing any side effects, because the most common reason patients are not compliant is they may not like the side effects they're experiencing. So having that deep conversation with them and making them feel heard and supported, so then we can go in a direction where they feel compliant, that we are there to help them and making them seizure free, and that's our utmost goal.